In 1998, we began a shift to more of an intensive group focus and now run an all-day Saturday comprehensive CBT session. In the morning, we cover the cognitive material. One big strategy is learning to stop and control our automatic negative thinking, and then changing our thinking to more rational interpretations, with the emphasis being on this occurring automatically as time goes by. Other cognitive strategies we will be learning include how to slow down and reduce our anxiety, how to see ourselves and the world around us more realistically, how to be assertive when needed, how to take more control over our own thoughts and feelings, and how to approach situations more realistically and rationally. The behavioral therapy group is active and structured and designed to work so that we work on our own anxiety problems, ones that cause us trouble in real life. We work on these anxiety hierarchies slowly, gradually, step by step, and in the presence of other group members, all of whom have social anxiety disorder. A complete explanation of the behavioral therapy group and the activities that are involved in it is included in this audio series on overcoming social anxiety. Although the research has been extremely positive and definitive, the actual practice of putting this research into action has been extremely slow. In this case, research has moved much faster than clinicians have been able to implement it. For example, although our websites are currently registering 4,000 or so visitors a day, we have found only a few therapists anywhere in the world who use cognitive behavioral therapy and run comprehensive programs, including the behavioral group as well as the cognitive learning component, both of which are optimal to overcoming social anxiety disorder. Things do seem to be improving, however, but how soon comprehensive CBT becomes more widely available is anybody's guess. Social anxiety disorder is the third largest mental health care problem in the world, affecting millions and millions of people. But even in large metropolitan areas, there may be no therapist or no clinic that specializes in treating social anxiety disorder and has the necessary CBT groups for treatment to be effective. It is because of this lack of treatment availability and the desperation we read in people's letters to us that this audio series was made. It takes a lot of guts for people with social anxiety to pick up the telephone and make an appointment to go to therapy. Then when they get to therapy, many times they find out that the therapist really does not understand social anxiety at all, does not understand what you're going through in your daily life, and really has no idea how to help you get over this devastating anxiety disorder. Hopefully, this is beginning to change, because when a person with social anxiety encounters professionals who provide no assistance, they tend to withdraw and give up searching, believing that they will have to live with social anxiety for the rest of their lives. It doesn't make much sense to keep subjecting yourself to being misunderstood. This sense of helplessness and hopelessness is underscored by statements that have been made to us by people with social anxiety. No one understands what I'm going through. If the doctors can't even understand it, then what am I supposed to do? I guess I'll never get any better. The vast majority of people with social anxiety disorder who come to the Institute have very detailed stories about seeking help for social anxiety and coming home feeling hopeless and empty. Social anxiety is such an all-life-encompassing disorder that I don't believe that anyone can fully comprehend what it is like unless they have experienced it daily in their own personal life. Many people, including professionals, continue to see social anxiety and the other anxiety disorders as nervousness or neuroticism. They cannot seem to comprehend how living daily with social anxiety makes it impossible for people to lead anything that approaches a normal life. For example, social anxiety disorder is very restricting because too many events in life cause severe anxiety and avoidance behavior. Therefore, it is typical for many people with the disorder to take jobs that are well beneath their capabilities, simply because the social requirements of another job may be too stressful or too pressuring. At one job, it might be necessary to be the center of attention, or a person may be expected to run and conduct business meetings. These would be difficult, if not impossible, tasks for many people with generalized social anxiety. Some people with social anxiety find it difficult to hold down a job at all and seek some kind of government assistance. But not everyone with social anxiety has what we call a social anxiety job, although perhaps a majority of people do. Many people will not accept new assignments or promotions at work because that would put them in a position in which they would need to supervise other people, something that would be too pressuring and anxiety-causing for them to even consider. Now let's look at the numbers. Social anxiety has been a long-neglected anxiety disorder. The latest government data show that between 7 and 8% of the population at any given moment suffers from some form of social anxiety. The vast majority of these people do not know what is disrupting their lives and therefore never seek treatment. This is a major problem at all life ages. Young children may develop forms of social anxiety that prevent them from going to school, while other children develop a type of social anxiety called selective mutism, which makes it difficult to speak out loud to other people, many times including family members. Social anxiety itself, although the beginnings can usually be traced back to childhood, typically hits in the late teenage years. There are many exceptions to this, however. Some people develop social phobia at later points in life, and this can also be quite typical. Why does it occur? No one has a complete answer to this question. There seems to be a general predisposition to anxiety that is hereditary, but the role of the environment appears to be stronger in causing social anxiety relative to some of the other anxiety disorders. The majority of people with social anxiety disorder come out of backgrounds that involve some type of trauma and/or many negative life events in which they felt helpless to change. Although parents, immediate family, and peer groups make up the bulk of these problems, these negative life events do not necessarily come from these sources, so it would not be accurate to make a blanket statement concerning the cause or causes of social anxiety. As an example, one of my people was teased and harassed by his class members at school from the time of junior high all the way through high school. He was called fat and was repeatedly made fun of because he was overweight, wore glasses, and was shy. He could not respond to the teasing at the time, and this just intensified the trauma of it all. Essentially, he buried all this criticism and negativity, and it made him more reclusive, inhibited, avoidant, and distrustful. Eventually, after several years of hearing constant negative feedback, he began to believe what he was being told. Once this happens, a full-blown social anxiety may be in operation. Some adults with social anxiety grew up in negative households where they were beaten down in one form or another. Some households were controlled by one of the parents in an authoritarian way, and they squelched the spirit out of their child. In other situations, family members tromp on the rights of the child and leave them with no self-esteem and no self-respect. This is fertile breeding ground for the development of social anxiety. Another one of our people grew up in a home that was pleasant, but was controlled financially by a grandmother. Although no one liked the manipulation and control of this grandmother, everyone was afraid to stand up to her because she held the purse strings in the family. Thus the child in this situation had no voice and no way to express herself. Her grandmother was always right, and she was always wrong. This situation proved not only frustrating and anger-arousing, but it was terrifically anxiety-causing and led to the development of social anxiety in this woman. At other times, the initial experience that leads into social anxiety can seem to come out of the blue. For example, a person may have a happy family background and school background and develop normally into adulthood, only to find that on the job they're required to do some task that for some reason freezes them up and scares them. Many times this is unexpected. It has never happened to them before, and therefore it is traumatic. The person is then left in fear of another situation like this one occurring again. Several of our people with social anxiety lead fairly normal lives, except when it comes to work. At work, a fear might surface about making presentations, introductions, or being put on the spot in front of coworkers and the boss. While this fear may not intrude on the daily functioning of the person outside of the work location, it wreaks havoc on the person's life within the work environment.